Oh no, my I know. Oh yeah.
I'm in charge.
You're in charge.
Although that's the good word.
I'm in charge.
Are those wonderful words? For those of you who don't know me, I'm Dean Friedman with the Arizona Autism Coalition, and I'd like to introduce you to Brandy Petrone. Brandy is a lobbyist extraordinaire with Goodman Schwartz, Public Affairs. I wanted to make sure that I got the name right. Anyway, the president of the Arizona Autism Coalition, Ann Monahan, is the past chair of a group called APAD, which is a group of DDD providers. And they actually hired Goodman Schwartz. Because of Ann's relationship, Goodman Schwartz is really nice to us, and they let Brandy come here. And don't tell anybody, but they don't charge us. Anyway, if you see legislative information coming out of the Arizona Autism Coalition, Brandy is our Uber source. So without further ado, unfortunately, Ann is in Kansas City, so she's not here. She sends her regrets. The other 3 board members also, unfortunately, has conflicts today, so you guys get stuck with me. But Brandy,
with me too.
Good morning, everybody. Thank you for having me. So I was going to try not to use the microphone. I can hear me without this. Does that work? Okay, if it does, at any point in time I get cut off, let me know and I'll record it.
Mind if we just kill the sound too?
Is it possible? Whatever works.
You know better than I do.
Whatever works. Want to make sure everybody can hear. So again, Brandy Petrone with Goodman Schwartz Public Affairs. As Dee said, we do represent the Arizona Association of Providers for People with Disabilities, APAD, and is our immediate past chairwoman, as Dee said. So we've been happy to come here and provide you all with information on the legislative sessions and provide information to the coalition as we can on what we're seeing. I was asked today to provide you all with an update. The legislative session started the second week of January, and talk about the budget, which is basically the biggest item, as you all know, from a legislative perspective, and then talk about a few bills of interest that may be of interest. Any questions I can't answer, we'll definitely get back to you all and get you any information that we can. And if there are bills of interest that you all know about that I don't raise, please let me know. We'll get you all that information as well and make sure that you all have information about legislation of interest that I may have missed. So I'm hoping that this is an open dialogue between all of us. Feel free to ask questions and type in on things that you know, because I think that's what's important for all of us to share what we're hearing and seeing as we get going. So I apologize, I've got to kind of hang out there right there. Here. So again, we're going to budget a little bit about the orienters, which we've talked about before. You all will have this presentation available online, so I've tried to provide links to where we got this information. So if you all want to get more into detail about anything, so we've got the links on most of this, so you all can go into it. But from the executive budget, so the governor is required to put out a budget at the beginning of the legislative session, that first Friday when they start. Under the Governor Ducey administration last year and then this year, the executive budget is essentially what we're working from when it comes to what is going to end up being passed. Prior to this administration, the Joint Legislative Budget Committee, which is the budget office of the legislature, used to put out a legislative budget that their leadership would put out. What's been happening this cycle and last cycle with Governor Ducey is the legislative leadership is working with them prior to the executive putting out a budget. So this tends to be what we work from the majority of the time, which is why we're focused on it. So these are the items that the executive budget summary that they've put out as their most important pieces in their budget. So you might recall that the governor has said that he wants structural balance in the state budget by the end of fiscal year 17, and they are still headed towards that goal. Education has been front and center from a budget perspective, and we'll talk a little bit about Proposition 1, 2, 3 and the special election. But they do add additional money to education in this budget as well, $106 million, as well as some supplemental funding. And then they talk about universities as one of their priorities in the budget, and they have an additional $4 million in fiscal year 16 and $14 million in the next fiscal year. I'm sorry. They also, a very big item, as you might imagine, is child safety. We've all heard about the issues going on in DCS. So there's a $134 million increase for child safety. And the governor's office is focused on prevention, cases coming in, what's happening while they're in the system, and then afterwards. So throughout the budget process, they provide money in each of those areas, including helping the courts get through cases more quickly. They also allocate an additional $31.5 million on a border strike force that you might have heard the governor talk about. And then there's money in there for Correction Center in Maricopa County. So those were the high-level pieces that the governor's office talks about, and I thought obviously what's most important to you all are some of the healthcare issues. And to be quite frank, it's very quiet on the healthcare side. Over the last few years, we've been dealing with provider cuts, dealing with the hospital assessment, Medicaid restoration. There's been a lot of healthcare issues that have been happening and kind of taken the forefront, and then obviously child safety. This share child, but generally healthcare is quiet. So in access, the big item in access is the restoration of the adult dental benefit. You might know that adults in the EPD and physically disabled population and the developmental disabilities population didn't have dental coverage, and so they are restoring that in both pieces, both EPD and DDD, and that costs $2.6 million. They are adding more money in access for fraud prevention and debt collection. So they're adding some FTEs to look at collections and looking at provider records. And then they have, as you all know, go ahead.
Yeah, Brandy, can you explain to us what that's going to mean in practical terms for those who work for provider agencies? As an audit.
That's an audit. That is more people available to take a look at cases, absolutely. Audit and fraud. And you all, fraud has been a big issue down at the legislature over the last few years. We've seen a lot of bills dealing with access fraud. And quite frankly, access, there isn't a ton of fraud, but this is definitely kind of headed in that same vein with providing more folks in that unit. And then, as you all know, behavioral health moved over from the Department of Health Services into access. That transition is essentially done as far as the physical move, and all the paperwork has actually already been moved over to access. I believe they have literally like 4 people left at DHS, and those are people that are paying to come out of DHS and doing some of that final paperwork, but literally everybody has moved and it's over at access at this point. When they made that change structurally in the legislation, they did not take any cost savings. They said, we're going to move it and then we'll see where we get those efficiencies and savings. And so in this budget, they are scoring $607,000 savings from that transition because of duplication of administrative efforts and getting rid of that duplication. So you see that as a savings in this budget. There's additional money for adult protective services for their caseload growth provided last year as well. Their projected caseload growth was 4% for 15 and it came in at 19%. And so they're taking a look at that and providing more folks to deal with their caseloads. There is additional money for vocational rehabilitation. You all probably are aware that there's a wait list. There's over 4,000 folks. They're providing additional money for both rehab. And then there is $2.4 million for what they call the DDD structural shortfall for room and board. So this is for folks that have residential services, the money that's provided for shelter, food. This line item has been structurally unsound for several years in DDD. In fact, what the division has been doing is backfilling that fund with extra money, so to speak. So if for example, 1 year they didn't have as much growth as had been anticipated, so there was a little extra money in capitation, so they took that in order to fund that. They are out of options, so to speak, as far as any, and so they've asked for additional money to backfill this fund. What APAD is concerned about, quite frankly, is that that money doesn't do anything to actually change the reimbursement rate that providers receive in this case. So we've been talking to folks about, we know that they need the money for the structural shortfall, but no change will be made in the actual reimbursement. So for some providers, for example, that's about $4 a day that they're receiving to feed somebody. And so that amount, because this only fixes the structural shortfall, doesn't actually increase the total reimbursement. Go ahead.
The other point, I don't know if they understand with this 2.4 mil, there's no federal match.
Correct.
And that's why it's so difficult to get the legislature.
Well, and quite frankly, you're absolutely right. So this is the state-funded long-term care account is what it's technically called, and there is no federal match for this. It's state funding only. So in the past as well, if there has been money available, there's been a 2%, 3% and 2% over the last few years for increase in provider rates. it's gone to the pot of money where there is the federal match, because obviously that money goes farther, right? So that makes a lot of sense, but then this fund has then become sorely underfunded, continued to be underfunded. And so we understand sort of the history and why it's happened, but eventually something's got to change. But again, this doesn't do then anything to address the reimbursement rates, which is obviously of great concern as well. So more work to do on room and board. So I thought that this was a good picture to show you all. We talked about this, I think, the last time I was here, when child safety moved out of the Department of Economic Security and became its own agency. That left DES with having DDD as the largest chunk of their general fund dollars. So this used to be very different, where DCS would have been the majority, right, of the DES funding. But now you can see that DDD is the majority of DES. And so now when folks look at the Department of Economic Security, they are highly focused on the Division of Developmental Disabilities, because that's where the majority. I thought this was a good thing for you all to see. Probably can't read it, but you've got employment, rehabilitation, adult services, some Medicaid eligibility, and then child support. Those were the large, exciting, so to speak. That we were concerned about last year, where DDD and behavioral health, some of the smaller providers were held harmless from. The hospitals ended up also being held harmless from. So there were no provider cuts last fiscal year. There are no provider cuts suggested coming in this budget either. So this is from the governor's office, where they end up in their budget. And what they show is the increase in the K-12 education spending, an increase in access funding, an increase in corrections funding across the line, and so forth. So this is where we end up by fiscal year 17, which is the budget that they're working on. We have a $9.4 billion budget here in Arizona. The budget, generally speaking, anything you've heard about?
I'm curious, why does health services go down so much?
So Department of Health Services goes down so much because you've lost behavioral health. Yeah, so now it looks like a very much smaller agency, doesn't it? Right. And remember, and these are their total, this is general fund dollars, so right, so we're not seeing the rest of the funding that DHS has that's federal. You're not seeing the rest of the funding in DES that's federal. This is all just state general fund dollars. So this is the executive budget's recommendation where they end up.
I do have a question on your slide before. When you say that now that DDD is the larger chunk of where the money is going towards, and you're saying that now they're more focused on DDD, obviously, because of that. What would you say are the pros and cons of this being focused?
Absolutely, that's a great question. So what are the pros and cons, if folks didn't hear the question, of DDD being focused in DES? I think, generally speaking, the positive is that issues that arose in the Division of Developmental Disabilities and just generally in the community got hidden underneath what was happening from Adult Protective Services at the time. So from a DES perspective, what the agency had to focus on was APS issues at the time. And so DDD did sort of become sort of the stepchild to those issues. And so I think now that helps elevate it from a DES perspective, that, hey, this is where a lot of your funding goes to, general fund speaking, and we need to be paying attention to it. So then the con to that obviously is, well, now we know where the money is, and if we needed to take some savings, where's it's going to come from? Well, it's going to come from DDD. But quite frankly, that's where it came from before as well. So I don't know that elevates, they were cut before when general fund savings they do then end up being the highlighted item as far as any savings that needed to happen from a general fund perspective, just because you can see the smaller pieces are so much smaller, there isn't as much wiggle room there.
One of the positive community should be happy about, new director, Dr. is really focused on meeting the needs of DDD, are we calling them consumers, clients, members?
I hear it all.
Whatever we're
Okay,
calling them today.
we'll call them members today.
She has just, I heard yesterday that she has just appointed Sherry Wentz to be in charge of compliance. I don't know if any of you have had the privilege of working with Sherry. Sherry knows better than anybody except Brian Lentz, who's only working 2 days a week now, part-time. Knows all the ins and outs, and trying to meet the Medicaid regulations, because contrary to what everybody thinks, the DDD staff does not sit around and think of requirements for providers to meet a choice. Those all come down from the feds. There's nothing compliance-wise that DDD requires. They can't trace that to the feds. They don't get the federal money. So you're talking 70 cents on every dollar. It's a big deal. Sherry, who knows Medicaid health, and who's really committed to I think the future, and I think that Sherry can really help Dr. Love when it's time to be called on the CARB legislature, and also Tim Jeffries, the
new director.
DES director, and I think she can do a really good job articulating why the money needs to be spent, where the money needs to be spent. I'm really encouraged that the room and board fund was even in the budget. So she's obviously got the governor's ear. So I think we're going to see good things with this team.
Yeah,
That's my opinion.
well, personally, I think Dr. Love's hired a lot of great folks, brought on a new medical officer, and that was sorely needed in the division. And so they're getting staffed up, so to speak, where they haven't been in the past. So I think that's positive for them. But it's sort of a wait and see. Now that everybody's new and in, now we've got to see sort of where that goes and where that heads as far as sort of yet to be seen. But I think they are making some positive changes and getting staff. So that's good. Does that help answer your question? So wanted to bring up a few pieces of legislation that are going through the process. And like I said, if any of you all have other legislation that you've heard about, would be happy to answer questions. If I can't answer them, we'll definitely get you the information for it. But this first bill I wanted to mention is House Bill 2099. And this is a DES run bill. So the agency itself is running the bill with Mr. Allen, the chairman of Children and Family Affairs in the House. And they're calling it a cleanup or technical bill. So there are changes that they're going through statute and cleaning up. The reason that I raise this is that some folks have asked questions, is it really technical or cleanup? And so far, nice, but I think it's good for everybody to take a look at it. I mean, aren't any and that they're not doing, can't do, haven't done. And so we're just getting those requirements out of statute. But deals with ATPC requirements. There's secure facility requirements in statute that I guess we've never done before, applications for, and there are some changes to definitions. So I would encourage everybody to take a look at that bill. We can make sure that we get you all that language just to make sure, because there's great intentions when we do technical type cleanup bills, but sometimes there's changes that we make that have unintentional consequences. And so I think it's good for everybody to take a look at this one. House Bill 2309, and then there's the companion bill, same language. Senate Bill 1385 is on the Children's Health Insurance Program, so CHIP, or Kids Care as we know it here in Arizona. As you probably all know, we're the only state in the country that doesn't have an active kids care program. You might recall during the bad budget times, we created a freeze on kids care. There is now federal money available that would pay for kids care for 2 years. And so there is a great big push trying to get that freeze lifted here in Arizona while we have some federal money to pay for the program. So these two bills would do that and would lift that freeze. The has created a very large coalition called the Cover Kids Coalition. And when you get the electronic document for this, you'll be able to click to that link to their website to see the information. But they are asking for any and all folks who support getting kids care back, even if it's temporary, to weigh in with them. They're collecting logos and of support so that they can keep agency names. And so I believe that the coalition is supportive. I don't know if you guys have taken a vote, but I know individually as well, I think it would be great if your organizations do support to also weigh in with them, and if you're comfortable lending your name to that, to do that. And I think they're asking for logos and everything. I know APAD has signed on and others. So this would be a great thing to do if that's something that your agency would support. I think what we're hearing, I don't know if these bills will go through as is or go through at all. And the reason for that at this moment is we're hearing there might be negotiations with CMS and the federal government because we have our Medicaid waiver going through right now. But we need these pieces of legislation to be moving and available and out there depending on how this all works. So as they go through, I know that the coalition and APAD would ask for folks' support. The coalition will be sending out information when they're heard to weigh in for your support. And so if you information out to you. Any questions on these? House Bill 2388 is a bill that APAD is working with a whole host of coalition members. It stands for Achieving a Better Life Experience, known as the ABLE Act. And I don't know if folks have heard about this. This was the federal law that was passed in December of 2014 that allows individuals with disabilities to essentially create and open up savings accounts where they're able to save money to then use towards their disability expenses. The great thing about the ABLE accounts is that the money in the account does not count towards the means testing for Medicaid or Social Security. So that's why there is the benefit to them. So they're able to put in up to $14,000 a year into an account. That can come from anybody. It can come from the individual. It could also come from family members or however that works out. And then there is a lifetime limit of $400, and I think it's $19,000 now. The way the federal law is written is that it's based off our state's 529 education plans, and federal IR accounts are known as 29As. And so these are subsets of those, and so that's why we have that limit. So the lifetime limit is fairly high. I don't know that necessarily the folks that we think will use these will get that high, but that is the limit. And then for Social Security purposes, it's $100,000 of, once the account hits $100,000, then their Social Security is suspended, but they don't lose Social Security in the way that they're not kicked off of it. So then when the account goes back down under $100,000, they get put back on. They don't have to go back through that process. So every state is able to set these up just like 529 education accounts. And so we're hoping that we're able to get an Arizona program created. This program would be in the Department of Economic Security with a committee that would help set it up and oversee the program. And essentially what would happen is DES would contract with one or more financial institutions across the state to allow individuals to set up the accounts. Go ahead.
Do you see any pushback from the legislature on this?
You know, so far we've been getting great support from the legislature. The main concern is there's an appropriation on the bill of $240,000. The reason for that is that we needed some startup funding for DES to get it going. We figure there's probably going to be a year or two before we get enough accounts to make the program self-supporting. What will be in the contract with the financial institutions is the ability to charge an administrative fee, which will fund the program. But until we get enough accounts to have that fee going and make it self-supportive, this agency needed some funding. So that's really the only pushback we're getting so far. And that, you know, we've been working with the governor's office from the very beginning on that. So they're very well aware that that's coming as well. So we think we've done as much as we can, and hopefully we can get this passed in part of the budget.
Brandy, can you just explain, I know some of us see stuff on the national level, and we see that there was a big push last year to get the states to do this legislation. Can you explain why here in Arizona purposely waited for this year?
Absolutely, and I think it's a great thing that we waited. So the federal law passed in December of 2014, and our legislative session obviously started January of 15, right? So literally just a few days after this happened. And we have legislative deadlines in Arizona that we have to meet in order to pass and get legislation enacted. And so we literally had about 3 weeks to try and get this done and at least get a bill introduced and started. And so what we found when we were working with folks, APAT and others that were working on this, is that, you know what, this is not something to rush. We wanted to get it right, wanted to make sure that we only have to go to the legislature one time and really do it right so that we're getting it through. The other piece of that was that the federal guidelines hadn't even been drafted yet. So the IRS, Treasury, Social Security were all working on guidelines. And so to us, it felt better to wait to see what those look like before we started something. So that's why the folks, APAT and others were involved with the coalition, wanted to wait. And so we've been working since May as a group of stakeholders to work on the legislation, take a look at the guidelines that have since come out to make sure that our program fits within that, and we hopefully don't have to come back. Ironically, there were several states, a handful that had passed it really, really fast. They've all had to go back and change their laws. So there is actually no state yet that actually has an active ABLE program that is officially up and running. We believe there'll be about 4 or 5 states that get up and running by summertime or maybe a little after summer. So it took everybody that long. So we're not in last place. We could be up in first place if we're able to get ours passed as far as speed and timing, but I think it took everybody that long anyway. So I think Arizona's done it right, in my opinion. That make sure that we're getting. In fact, when the law first passed, the way it was written is that every state had to create an ABLE account program in their state in order for their state residents to open up an ABLE account. That was actually changed in the budget on the federal level in December. So that actually was a change that happened really, really fast as well. So now, just like the 529 education plans, individuals can actually go to any state that they want to open up an ABLE account. So what we're hoping is to create an Arizona program that is not only competitive, individuals from other states will want to use ours, but that actually really works well for Arizonans and has Arizonans involved in setting it up. And we think that's really important. In addition, is having state or local financial institutions, so folks can actually go to the financial institution. We think that's important as well. So that's why we think it's important to have an Arizona program. Did I get that right, Dee? Any questions on the ABLE Act? Anything we can help with? Yeah.
Did you say there will only be like 1 or a few financial institutions?
So no, nobody's been chosen. The way the statute is written is that DES will essentially go out for an RFP type of process, and along with the committee will choose 1 or more financial institutions. So I don't know what that will look like. It could be 1, it could be 2, it could be 3. I mean, we just don't know yet. But the statute talks about what information they need to gather from that financial institution in order to make that decision. And so along with the committee, and the committee contains individuals with disabilities, families, financial folks, lawyers that are involved in disability issues to help guide DES on making those decisions.
Is that because they need to keep track of all plans and
Yes. There is
small number of systems?
There's a lot of financial reporting requirements that go along with this, as you can imagine, especially from a Social Security standpoint. And so the federal government is requiring the states to provide a lot of information back to them on a monthly or annual basis. And so the state, our DES, will need to be working with those financial institutions to make sure that the contracts are set up correctly, to make sure all that information is flowing as it needs to, and so that our program meets the federal requirements. Yeah, because as you can imagine, the federal government wants to make sure they know where those limits are, especially the $100,000 for Social Security. So that information needs to be able to get back pretty quickly. Any other questions on ABLE Act? Yeah, go ahead.
So you said that federal level is going to be, you can go to any state as a member. So right now, Arizona members get an account in another state.
Not literally right this second, because no program is up and running, but sometime later this year, summer, maybe late summer, early fall, we believe that there will be a handful of states that will have their programs up and running, and so they absolutely could choose to do that then.
So they're not going to be required to go through DES to get that account?
No, they don't have to use an Arizona program. what we've heard from folks though and families is, well, I don't think I want to go to the State Bank of Nebraska. I mean, when am I ever going, you know, whatever state it is, but I don't think that's the financial institution I want to use because I could actually never physically go there. And for some folks, that's okay. They're going to do it all online and maybe that's fine. But that's what we're hearing from folks is I would rather have someplace I could go to here if I needed to. And that's why they might choose to wait. But you can only have one ABLE account period across the country. And so wherever you go, that's the one you get, or you're going to have to move it should Arizona open, for example.
I wasn't sure if you mentioned that also this is only for people who are disabled prior to 26. So there's a lot of people left out.
Well, and is that, so it's prior to 26 or with the certificate, which I believe could happen after 26, is that correct?
Pardon?
Or those who get a certificate? It's both, I thought. The way I read the federal law, it's both.
The federal law limits it to people. It was part of the deal that got made.
Okay.
Through.
So under 26?
So it's just people who have some documentation that they were disabled prior to 26. They can be any age, but they were disabled prior to 26.
Okay, thank you for mentioning it. I'll take a look at that again because that's not how we had read it, so we'll take another look at it. Okay, thank you.
Do parents set these up for their kids?
So the individual themselves is the owner of the account unless there's a cognitive issue where they wouldn't, so they're the owner. Obviously parents with kids under 18, then that's different. They're able to make the decisions for their folks. Yeah. Any other questions on ABLE?
It says must be eligible and it gives number 1 individuals diagnosed with disability 26. But it says number 2 individuals must receive federal benefits under SSI or SSD program and receive a disability certification.
It is definitely social security. I forget the titles now. I should have brought my bill with me, but
What that means
yeah.
is that they will, just like they do now, the access free to work program, if they're not on SSI or SSDI, they'll have to go through a DPS determination. It's the same as if they were applying. And the only thing is they won't look at assets. So they'll make a decision. They'll just look at it as a disability determination. So they'll have to qualify for the same category of functional limitation that they can get SSI or SSDI.
You all might have heard, it was in the news quite heavily this last week. There's been a bill that was introduced to essentially get rid of, depending on how you look at it, first things first. This has actually been tried in the past before where there's been legislation introduced to try and change the funding or where the funding goes to. And first things first, you might remember first things first was a ballot initiative originally, so it's voter protected. So this is another one that's out there that would take a look at first things first. It would allow the first $30 million of the tobacco tax funds to be used for programs that would qualify for matching state expenditures. And then the remaining funds would go to the K-3 literacy program. The bill you might have heard about last week would have had all the funding going through K-3 literacy program. So the bill from last week was held. It was not heard in committee. There was a great push by advocates and the like to not have that heard. I don't believe that this one will go anywhere either, but it did get introduced, so I wanted to bring it up and let you all know that it is out there. In an election year, having something like this on the ballot is probably not good for certain parties, and so I could see this just not heading anywhere this time. But again, I wanted to make sure everybody knew it was out there. Senate Bill 1121, I don't believe is going to get heard, but I wanted you all to know that it was out here, and it's on behavior analysis, and it's changing definition of behavior analysis. So this was brought by a group in Southern Arizona that does behavioral analysis, and they're having issues with funding with access and reimbursement. And so this was a legislative fix trying to fix this issue with reimbursements from access. I don't believe that it's going to go through because we heard that they're still working with access from an administrative perspective and trying to do this without legislation. Also, this bill would have been what's called a sunrise. So in Arizona law, healthcare professionals, if you are trying to get or changing your scope of practice, you have to go what's called through a sunrise process. So every year on September, if you're trying to do that, you've got to turn in an application to the legislature that says why you need the change or why you need the licensure, what it does to protect the public. And then between the two health committees, committee called the Committee of Reference, and they make a recommendation to the legislature on whether or not that change in scope of practice or licensure should get the legislature. So this would have also been a scope of practice issue, and they did not submit a sunrise application this year. So I believe they're going to hold off, not try and push this bill this year because they're still working with access and also because of the sunrise issue. But should something change, not work out with access, I could definitely see this coming back next year and going through the sunrise process. But again, wanted to make sure you all knew that it was out there and floating around and that there are some reimbursement issues. Is anybody here know any?
Therapy, which is like an ABA approach, but really is dealing more with like thoughts. So it's
Like
kind of would use like a psychotherapy
Yeah.
code. You know what I mean? I think there's like some, I forget, there's like 5 things.
I was at the State Energy Advisory Council meeting, and this was one of the ones, they just said they were still working, conversation was still going on. So I took, since they said that publicly, I took that to be that they were continuing to try to work on it, so.
That's good, and that's what we had heard too. So that's why we don't anticipate this moving. If they're still trying to work on it administratively, I would think that they would continue to do that.
There were actually some good relationships that were formed between Access, the medical directors for the health plans, and the individuals who sat on the Access ASD advisory committee. And some of the individuals involved with this bill, like Aaron, worked with the committee. So I think they're gonna take care of it. And if they have to run a bill next year because they don't have a choice, then it'll get through with Access's cooperation. It's not gonna be contentious at all. And this wasn't set up to be contentious either.
No. I don't think anybody took it that way. Yeah, I don't think
But
anybody.
for the autism community, Brandy, this is like light years for us to be able to say, we're working with the health plans, we're working with Access, we're working with the providers, we're working with the professionals, and everybody's working together. It's not contentious. This is like, let's set off the fireworks news. It's only taken us a dozen years to get there, so.
Good. I do know, just Aaron, for your information, if Senator Bradley was told about the potential on the sunrise issue, and I think that got communicated back to Dr. Giles. But that's right, that's that's the right person. But so that might just be something for everybody to consider depending on what needs to change for next year. My political recommendation would be you don't want to have that argument come next legislative session. If there is any opposition, you want to get all your arguments off the table. So sometimes it's just something you've got to go through just to get rid of an argument. And I should say, just for public disclosure, we do represent the psychology board. So for full disclosure, I should say that. So Senate Bill 1216 on charitable tax donations. So this is the charitable tax donation that we can all use. Right now, the limit is $200 for an individual, $400 for a couple, and this would change those limits to $400 and $800. So if that's something that you're interested in, it's being heard next week in Senate Finance. So if that's something that your program utilizes and is a part of and asks for contributions, that might be something you want to look at. I know that there are some nonprofits that actually take a different approach to this. While they're not in opposition, so to speak, of this change, they would rather see the general fund not be impacted and be used towards things like kids care, towards TANF and other issues that have been popping up and not funded. And so there are some nonprofits that aren't taking that approach, but wanted to mention this to you all, and it is being heard next week. And then Senate Bill 1217 is a partner to this bill, also being heard next week. And it would change the date that you can actually provide the contribution to April 15th. So you could actually give up until April 15th of this year, for example, and have it count towards last tax year. You can choose the tax year if you do it to April 15th. So both bills are being heard next week if that's of interest, Senate Finance.
Okay.
Sure. These are two bills that came up this week as an issue for the disability community that I just wanted to raise your awareness of. House Bill 2258 and 2257. They deal with mobile homes and the ability for landlords and mobile homeowners to make changes to the Landlord-Tenant Act. And 2258 has raised concerns that it would basically restrict reasonable accommodations in the mobile home. And so the community is talking about the fact that this doesn't even comply with the ADA. And so this bill, along with the other bill, interestingly enough, this bill has a lot of concerns with basically being able to kick folks out quicker than they are today, that a mobile home becomes abandoned and then they're able to send those folks out a little easier. Obviously, the disability community is talking a lot about the fact that elderly and disabled live in mobile homes, and so they don't obviously like that change. Both bills are sponsored by Representative Kate Murphy-McGee, who is a huge advocate for the disability community. And I don't think that she was aware of some of the unintended consequences or the questions that are coming up in its application to the ADA. And so the bill had been on a calendar, it got pulled. She's going to sit down with stakeholders and talk about changes for both of these bills. So I'm anticipating there will be changes coming and she'll get it worked out. But wanted to make sure you all knew that these were out there.
Has AARP weighed in on this?
AARP, I believe, is involved. I know they've been made aware of them this week. I know that Ability 360 was made aware of them and has been involved. The Morrison Institute has been involved. So a lot of folks have been talking about these bills. And like I said, Kate's going to bring the stakeholders together, Representative Murphy-McGee, I should say, and talk about these issues. So I anticipate changes on these two, but you all should be aware of them in case you do have folks.
I just see a snowbird issue when you're talking about what's abandoned.
Yeah, I could see that too, absolutely.
Well, it's not just a snowbird issue because it's also it's also prohibiting dump around service animals.
Right.
So it's just a really bad deal. And we did try to contact her, so, and eventually she heard enough to pull it out to talk to us more. But this was another example of a friend writing a bill without consulting the disability.
Yeah, and I like I said, I mean, she is such a friend to the community. I think maybe she just, I don't think really understood
Generally a very good ally.
where this was coming from. I thought this one was really interesting too, because it talks about limiting caregivers. And that's not even just for individuals with disabilities. It could be somebody who, broke both their legs and needs some help for a few months or something like that. And so there's limitations on having caregivers in the mobile homes too. So both of them are really interesting bills to keep a watch out and see what changes are made to them. So lastly, a couple of things on advocacy for you all to make sure that you're aware of. The governor's office has been doing statewide budget meetings across the state. There aren't any scheduled that I'm aware of, so that's why you don't have dates up here. They've been sort of announcing them as they come. So they've been in Prescott and Yuma and Tucson, going across the state talking about. So I would watch the governor's office website for those meetings if anybody's interested. And then Chairman Olson, who is the chair of the House Appropriations Committee, has announced that he's going to be doing some statewide budget conversations as well with folks. And so what's available information-wise is up here. They're going to be in Flagstaff this weekend. The rest of the locations haven't been announced, but this is the information we have today. Those are also great ways to get information in here and also let your voice be heard on issues. So I wanted to bring this to everybody's attention in case that's something you all are interested in participating in. Also, I just always like to remind folks, I hope you all know your legislative district, and that remember, you have more than one district. It's not just where you live. It's also where you work. It's also where services are provided or where you receive services. So always make sure that you're taking a look from that perspective. And then when you contact legislators, make sure they know you're a constituent and why you're a constituent. They do really want to hear from their constituents, and so make sure that they know that you are a constituent. And one thing that I recently heard from a couple of legislators is also provide your telephone number so that they can call you. There are legislators that really do want to respond back, and I've had a few legislators recently talk about the fact that they don't get enough phone numbers from folks for them to be able to reach out and call back. So just wanted to point that out too.
And I've been called back several times.
Good.
And even arranged meetings. But I noticed something different this year because I like to email a lot.
Yes.
I have lots of opinions.
Yes.
I like to share. And what I noticed is their email is different this year.
It is.
And so it's not as easy to email people that are not your local people.
You're right. What they've done is like congressional folks, they have a form that you fill out now. And so when you click on to email a legislator now, you put in your name and location and it goes to them, but you never see the actual email address. And so very similar to how congressional email works. So yeah, they have set up that system. I'd be happy to provide the coalition with some other information as well that you could use with this. Remind me to do that, okay? And then lastly, if you were not aware, so there's the request to speak system. I know I've talked about this before with you all. This is the way for you all to sign in on legislation. You do not have to go to the Capitol anymore, which is why I wanted to mention this. Previously, if you wanted to sign up for the request to speak system, you had to go to the Capitol one time, use their computer to create the account. You no longer have to do that. So I would really encourage everybody to get their families and self-advocates and your board, because now they don't have to go down there, and have that account available so that when there are bills, issues that come up, you all and able to go ahead and send out that information and be able to sign in on the request to speak system. So just wanted to make sure everybody was aware of that because it is a change.
Do you have to sign up every year? So
No.
Once you're in,
Once you're in. So what happened, I probably should rephrase this. So 2 years ago, they changed the system and a lot of folks' accounts got wiped out. And so a lot of folks had to go in and create it that one time, but no, after that, since it's been ongoing. So once you've created the account, you should have it. And I would definitely go in there and check it out and see if it works. If you haven't used it recently, I probably would do that. Also, they've created, there's more bill information available through that system now, bill status inquiry. And so when you go into it, you can get a lot more information. You can actually see who signed up on a bill now through that program. And so if you're interested in seeing who testified or talked or signed in on a bill, you can actually go look at all that up now. All the public information is available.
One of the things that you need to be cognizant of is this is really where the law begins. And This is really where change begins. And what's gonna happen now with all these electronic records, when attorneys are going in court and they're doing cases and they're trying to uphold our rights, they're gonna be able to get a hold of this information. And so depending upon who the attorney is, you may end up being contacted by these people to help them with their case. And it's an issue that may impact you directly. So the more that we respond and the more active that we are, the more vigilant that people like Nina and the Arizona Center for Disability Law can help us, because they'll have the proof that they need, to have the support that they need, or to convince a judge that really this is what was intended by the legislation. So, I mean, it's not gonna make the case airtight, but it's certainly gonna help.
Absolutely. The links here, by the way, for the request to speak system. So again, like some of those other links provided, you all have that once this goes up. And I think that was it. So happy to answer your questions.
Can I just ask a question very quick on the
Go ahead.
I was contacted yesterday by a family. There is a young adult who was kicked out of his home when he was 15. He's not from the state. He's here now. He's homeless. He has autism. And he has no services and no system. And he's in danger. So I'm wondering if anybody here has some ideas for me that I can sort of help him get services. So if you do, would you please see me before you leave?
Are there any issues that I didn't hit on you all are hearing about that we can make sure you all get information about? Bills or anything? Okay. I know there's
Service Animal Bill 1166 that got pulled from committee. It's all about certification and ID and training requirements for service animals. And it got pulled, but it is going to be heard Monday in Natural Resources Committee.
okay.
So evidently they're trying to fix the language, but again, it relates to ADA. So there's another bill by another usual friend to the disability community that was created.
Who's the sponsor, Amina? McGuire. Okay.
Mine's more of a federal level question, but we all just got hit with the whole companionship exemption
Yes.
thing. And I know they're talking about the salary cap being raised or minimum
To 50.
50.
Yep.
Do
52
you know
something.
where that's at, or?
That is, so the salary issue is still in process. The federal government took comments, and I believe the comment period has closed. And so that is still being worked on. The sort of prevailing thought is with most of the other regulations that are out there, the Obama administration obviously wants to pass their rules and regulations before they're out. And so there will be a big push to try and get that done this summer. That's just what I'm hearing. I really don't have any other information or kind of true knowledge on it other than sort of gossip in the community on that one, but definitely something to watch. Obviously the financial impact is going to be huge. We've actually, APAD has been in conversations with the division about that and companionship exemption for over a year now on the financial impact that has to folks and just the real world implications for families as well. And so we've been working with them, but to date yet, we're obviously not seeing any financial changes when it comes to companionship exemption. We continue to push from an APAD perspective, and we'll obviously do so for the if the salary changes as well.
The salary thing is only for exempt employees though, right? I feel like there's a misunderstanding that companies think like you can no longer have a salary.
Right. It's certain employees, certain administrative folks, certain managers, if I'm remembering correctly.
It's only like setting a criteria that makes someone exempt, right? Which is at the point where they can't get paid for overtime.
Right. So, well, it's bringing everybody up to that point. So right now the point is people correct me if I'm wrong, 30 something or 28 something, and now it's bringing that point to 50. So what folks are telling me is either they're gonna have to take their individuals up to the 52 something so that they stay exempt, or they leave them there and now they're paying overtime.
Yeah, I have a really hard time like relating to why people are so upset about that one. Like, someone that's making $28,000 a year should not be exempt. You know what I mean? Like, that just doesn't make sense. Exempt is supposed to be for licensed professionals, managers, that kind of thing.
So I know.
It seems kind of weird.
So APAD did a quick survey of our folks and our providers that are members to try and get a sense for what the impact might be to their folks who fall under this exemption would have to move up. The average impact was $766,000 per company per year. That's all that's.
Yeah.
That wipes out every small.
Or just pay them overtime if they work over 40 hours, you know what I mean? Like,
But then the would need to pay us more money.
The
Like,
rates
there's no
don't-
way that we
the
can
rates
do
don't
that.
cover the overtime.
well, sure, but I mean, direct support providers are not exempt.
No,
They wouldn't qualify.
the supervisors are, and
Supervisors, right. So,
Well, that's the key. It's either gonna be, it's either you pay them and you go to 52, or you pay them overtime. And either
I just
way,
don't
it's-
think, I mean, to pay someone $30,000 a year, make them work 60 hours a week,
but then
just doesn't seem.
sorry,
You
but
can
then
modify
it
the
affects
salary.
teachers and everything too. Are they really gonna pay all their teachers, or are those gonna be a
No,
special
that's a
case?
different category.
See, exactly. So then,
Yeah, definitely we've advised all of our folks and would encourage you all to take a look at it and take a look at the impact that it might have on your particular company, because there definitely could be a financial impact.
And going back to the families, all of a sudden you've had someone that's been working with your child for 2 or 3 years, or a year, or whatever it is, and all of a sudden that person isn't gonna be available to that family. And oftentimes the best people are doing the best work.
Yeah, the
And
companion,
all of a sudden they disappear.
lots of concern have been raised about the companionship exemption, absolutely.
This is where our friend Sherry Wentz at DDD is gonna be very helpful. Because Sherry's gonna listen, so she's gonna see what everybody's concerns are. And she also knows what Medicaid law is, so she's going to, be able to keep Dr. Love in the loop. And understand when you come to them with these very real problems. Because there are serious Medicaid issues when agencies can't provide workers to provide services that they're supposed to be providing. DDD is going to get fined big time by CMS. So it's a really complicated issue from all directions. And it's not like you can say that there's one side that's 100% right and another side that's 100% evil. Everybody's trying to do the best they can with the resources that are available to provide the best possible services. And navigating those waters is very tricky. So luckily, we have Sherry in that position.
I know that, I'm assuming it's every agency, but we were contacted at our agency and asked to submit a report stating how many families were impacted, the monetary, like how many hours they had to lose and everything like that. And so I know that that's something that they're trying to look at to see how it did impact the families.
Access asked for that information. Was that, yeah, Access had put out a survey that DDD then pushed out, trying to understand what the impacts are. And I know they sent the survey out twice because they didn't get the response that they were hoping for. They put it out for like so many weeks and then they did it again. So I haven't heard yet.
We were told it was pretty much mandatory to send it back.
Okay.
I
Okay.
don't know if you talked to them, but just a little bit of feedback. I couldn't figure out how to fill out that survey. It was like this
Okay.
really bizarre spreadsheet. where
Sure.
It was.
Put the answers, and I emailed them like, I don't know how to answer this.
Okay, yeah, we'll let them know, absolutely. Maybe if that's what,
Very strange.
we'll share that information, let them know that might not be why they got this response they were looking for. Okay, thank you. definitely.
Do you have any information regarding the access reimbursement rate for speech and language services?
Is this early intervention? So I am aware that Access is taking a look at it. There was a meeting that was held with Access and a few providers to explain to Access the issue. And it's, you all know that are involved in this, quite complicated, and that there were changes that were made by the AZIP program that Access was not aware of, come to find out. So there were some decisions made that I don't think went through the entire pipeline, so to speak. So Access has committed to take a look at it and to see if there's something creative that they can do to try and fix the issue. I actually reached out to them this week and I haven't heard back if there's any update. That meeting happened in early January and they asked for some time because it is so complicated to take a look at, and so we just haven't heard back yet, but Access is looking at it. In fact, the meeting was with Director Betlak and he was quite surprised at the complicated nature of what had happened and where that's at. But they're committed to taking a look at it.
Can you share what the changes were that AZIP made that Access wasn't aware of? Was it the 2 days normal?
So it's, I'm probably gonna have to get back to you and go back into my notes. I guess there was some conversation with Access that the AZIP administration, AZIP and Access, but not, I wouldn't say the higher ups, I'd say the folks that directly work together at Access and AZIP. And there was a change that was made like a year ago is what I'm remembering on how the reimbursement rate went through. And the upper administration was not aware of that decision. And I apologize, I don't have more detail than that. My brain is now full of legislative stuff, so I've got to go back in my memory a little bit. I know that was one of the things that Access wanted to look at is why was that decision made about a year ago? And is that something that they should just undo, so to speak, as one option? And I apologize, I can't remember what that was specifically, but that was just one option they threw out. I know that they wanted to look at. They also, come to find out, really didn't have the full population at Access understood. Well, they do flag these individuals in their system, but I don't think that they fully knew where their AZIP folks were in Access. So I think